Alright, what's up guys? So, today is January 3rd and I'm 2 weeks post-op. Um, I guess I should show the whole chest because I haven't done that yet. So, this is the chest. Um, it came out really nice. It's nice to finally be able to see the chest development that I've worked on. I'll be glad to see it when I start cutting for the year and see what's really under there. Some of the tape is starting to come off. I don't know if you guys can see. My incision's super thin because I haven't reached for anything or anything like that yet. Here's the side. I did have like some, it's still scabbing and stuff, but it's coming off. I had like a little sore here and the scab came off yesterday, so that's good. And then this side, the tape hasn't come off yet. But so far I feel really good. I haven't had any pain the whole time. But everything's going along really well. Things are going pretty fast. I know on this side, some of the stitches, like I have the dissolvable stitches, but they said that some of them might try to come out, like if they're ready to come out, and so they've started that already. And it's only been 2 weeks. I think that was a few days ago, and it's only been 2 weeks, so I'm pretty excited about that. I don't have any more swelling. Like all of this is, I had some swelling in the middle the first week or two, or the first week or so, I guess. And so all of that's gone. And so I'm not binding at all, excuse me, anymore, except for at night he gave me this binder to sleep in for the first couple weeks. It's like this. It looks like the post-surgery binder, kind of, and it opens this way. There's probably dog hair on it. I don't know if you can see the dog hair, but there's probably dog hair on it. Anyway, just kind of wraps around like this. You just Velcro it. So I've been sleeping with this every night, and I think that really helps the swelling. I'm still sleeping sitting up. Actually, I don't know if that helps with swelling because I haven't had any, but I've been doing it, so I don't want to stop doing it and have swelling. That's kind of been the theme of my recovery, is like I haven't really had any issues, and so I've been trying to really take things slow because I know I will overdo stuff, so I've been trying to take stuff really slow so that I don't end up with issues. So it's kind of, I haven't had any pain or anything, so I'm trying to really like make sure I'm not overreaching for stuff or doing stuff like that. But yeah, as far as the nipples themselves go, I'll probably have to show them, but they were like, I had all my color because my nipples were dark before. I had all of the color on them, like on the top layer of the graft, and then they said like the top layer will try to like start to come off. And so I had just been like trying to keep it on there when I'm like changing the dressings and stuff like that, because it will stick to these little gauze pads. And so now they're starting to come off, but I can tell like the base, like the under part of the graft has taken, and it has its own, because they're kind of pink now, so I can see like when I get out of the shower they're a little redder, so like they have their blood supply going and all that stuff. So that's a good thing. But yeah, everything's going really well. I'm just trying to like keep everything low key so I can keep things going well. As far as like working out and stuff like that goes, I can't start that until like 4 weeks or a month post-op. So 4 weeks would be the 17th of January, and then a month would be the 20th. So I'm thinking either the 20th I'll start, or like the Monday after that, which I think is the 22nd, because I think the 20th is a Saturday. So that'll be it. I have noticed like these tapes on the incisions are really itchy to me. So I've had really dry skin, so I've just been putting like cocoa butter lotion like right beneath it over here. I know that this part of my skin was really dry when I was binding though, and I always had to put lotion or something on it to like extra so that it wasn't dried out. The top of my chest was kind of dry before too, like up here. When we first got back, and I think it was just the gauze in the binder, the surgical binder, just kind of dried it out, because now it's not so dry. But I just keep putting my regular lotion around it, and then they gave me Bacitracin for the nipples, and then I went and got some more. So Bacitracin twice a day, and then I keep them covered with the gauze, just like this, just one piece of tape. So I haven't had any like reaction to the tape or anything. I didn't have to take any of the medication the entire time, so I took no pain medication, no nausea medication. I had no pain and no nausea, so I didn't take them. But, yeah, I'm really happy with how it turned out. I think it looks amazing. I do have, like, a little bit of, like, I don't know if you can see it, but a little puckering or so here and around, but that'll come out, like, once I'm able to move around and start massaging my incisions and stuff. I'm really surprised with this is the thickest part of my incision right here so far. So I'm really surprised with how thin they are. I'm hoping I can keep them relatively thin. And I know a lot of people say this in their videos and then sometimes come to regret it later, but I'm not super, especially right now, I'm not super concerned with them stretching because I'm just so glad that I haven't had any issues whatsoever, like no pain, let alone like actual complications with the surgery at all up to this point. So if all I come out with is a little bit of stretching at the end and maybe like some nipple color loss with still slightly larger scars and slightly pinker nipples, then I'd say that's a win because I had no pain the entire time. That's a trade I'm willing to make. So if that's what happens, that's what happens. But I'm gonna try to keep massaging them. I haven't decided what type of scar treatment I'm gonna use. I think I'm gonna use either. I don't think I'm gonna use strips. I think I'm gonna use like oil, like bio oil, or Mederma or something, or scar gel to massage into it. Because I know when I was stretching my ears before, I would have like keloids and stuff, and I'd have to like massage them out, and then it really helped my skin, like on my ears, like my skin like improved a lot just by massaging it out. And so I'm using the oil, so I think I'll do that here, and that'll probably help. Oh, as far as sensation goes, so I've been able to feel my entire chest like through the entire process. So even under the surgical binder, I could feel like all of this chest area, all like everything over here, all down the middle to my sternum, everything here. I can feel along the incisions, like they feel weird to my fingers touching them, but I can definitely feel it because I know my grandma touched it last night and I could feel her touching it. And it's like I can actually feel it on the skin. The one thing I can't feel is like right under here, underneath this nipple. It feels like there's something there. Like it just feels like there's something on top of the skin, and then I can feel it underneath it, which is what I've heard people describe their nipples feeling like. And then the nipples I can't really feel. This one on the side of it can feel like pain almost. Like it's not like painful, like it's not like a sharp pain or anything, but it's like if I like do that, I don't think this one has it, but it kind of like, it feels like there's something on my chest and then I can feel beneath it. But this one is on this side. The nipple itself feels this like, it's not a super, I don't want to, for lack of a better term, nipple-y sensation, but it's like a, I don't know, it's like a weird, like almost like if you had a cut and the scab came off but the skin was still a little thin and you pressed on it a little bit and it felt like that little, it's like little pain, but it's not really a lot. I feel like that's what this feels like, if I can describe that. And it's just this little, not very much, like probably like a little sliver of nipple under there that is like that. But yeah, so my main thing for the next couple weeks is just going to be paying attention to the nipple color as it comes back and seeing them. I want my nipples to be black again, but if they're not, that's okay. They were kind of pink in the middle before anyway, so if they end up a little pink, that's fine. Oh, and I do have nipple projection. I know a lot of people end up like losing it after surgery somehow. I don't know why or how that is, or like if it's gonna happen to me because I'm only 2 weeks out. But I do, even as the skin's been coming off and as I've been dressing them and sleeping in the binder and stuff like that, I do still have projection of the nipples. So that's kind of cool. I hoped that they either both had projection or neither of them had projection. Like I just wanted them to be the same, and so they're the same. So that's good. And then I didn't really care about nipple sensation. I didn't have much in the way of nipple sensation to begin with, so I didn't really care about that. Oh, something I really, really wanted that I didn't even think about before the surgery is, so I really like that the way he placed the incisions, they're definitely under my pec. They're very hard to see right now, also because I have all this tape on still and all that, but they're really hard to see, the pieces I have seen of them. The tape is coming up too, I'm going to cut that off. But excuse me, so they're really hard to see, they're really thin, they're definitely under the pec, so as my pecs continue to develop and stuff like that, and like right now, I'm pretty flat because I haven't been able to work out for a few weeks, so as I start working out again and stuff like that, and things start to fill out and everything, they'll be harder and harder to see, hopefully. They also came out pretty dark. I thought they were going to be kind of pink. Usually when I scar, I have scabs. When the scabs come off, it's kind of pink, and then it turns a little bit white, like really like paper white, and then my skin color starts to come back, and then it'll usually be a little bit darker. but they've just gone straight to being a little darker, and I like that. So it's going to be a lot less noticeable. I'm not going to have like pink that has to go away and stuff like that. Although I'm not too concerned about people noticing the scars. I'm not going to be, I probably won't be shirtless that often. So, and even if I am, I'm not really going to be in a position where people are going to, I'm mostly going to be around people who know what the scars are, so it's like not going to be that big of a deal. But it's kind of nice to see that they've healed well in a way that is not super noticeable. But something I wanted was that when I flexed, like my chest, I wanted both of my nipples to like move, and they do. So that's cool, because I know I've seen videos where like nipples don't move, people like flex their pecs, or only one nipple moves. Like I wanted both of them to move, so they both move. So I basically got everything I wanted without remembering to say anything about it. So that's cool. Yeah, I've also lost a bit of weight since I've been home too. I don't think I've lost too much muscle. It doesn't look like it. So I lost probably about like 10-ish pounds since. Yeah, look, I've weighed in. The lowest weigh-in I've had since I've been home was 10 pounds lighter than what I weighed when we went to the hospital. So I've lost like 10 pounds in like the last 2 weeks, which I'm not concerned about. I think my bulk got a little out of hand, and I was at a body weight that wasn't really sustainable for me anyway. So it was just not, at least not right now. So the weight just started coming off because after I stopped working out, I can't eat as much. I just don't have the appetite for it. So we'll see what I start doing nutrition-wise when I get back in the gym. I think I'm gonna just hop on a, maybe I should make a separate video about this, but I'm thinking about just hopping on a linear program for the first 4 weeks, because he thinks that my strength will come back to where it was in a matter of a month. I did hit a 225 bench the night before we left for San Francisco, so that was like 3 days, three days out from top surgery. So we'll see when it comes back. I'm hoping that it comes back and I can hit like 235 by June. That would be great. Or by May. But yeah, anyway, that's about it. That's about all the updates. It looks great. I love it. I'm wearing I've never worn so many t-shirts in my life. Oh, that's another thing. I wanted to know when people started wearing t-shirts. I was able to wear a t-shirt like I usually wear a large t-shirt. I was able to wear an extra large like the day of my post-op appointment, so about a week after. I didn't try to put a t-shirt on before that. I did put on a really baggy polo shirt though. It was a large, but it's kind of loose on me, and it's like way longer than a lot of my other polo shirts, so I was able to wear that like maybe 4 days post-op while I had the surgical binder on, and then I wore a big t-shirt after the post-op appointment. I put it on to put the binder over, because they recommended when I wear this to wear something underneath it. It makes it more comfortable, and it definitely does. So I just wear, one of these under which I've wanted to wear for my entire life and could never wear. So I just wear one of these underneath. I've been wearing one of these underneath all my shirts every day too. I feel like it helps the gauze stick down, because sometimes my gauze like comes up and I'm afraid stuff will like get in there. So I wear these like underneath on my shirts. I probably wouldn't if it was summer, although I'm in California and it's warm in the winter. We don't have winter here in LA County. So but I wear these under my shirts, and then when I sleep I wear it under the binder. I'm also going to be wearing this binder when I travel and when I fly, and I did wear, when we flew back from San Francisco, I wore the like compression socks from surgery on the plane. I have to fly back to Maryland in like a few days, and so I will be flying wearing those and wearing this, just so that the plane doesn't cause me, whatever airplanes do that cause you to swell up, it doesn't make me swell up. But yeah, so I'm just gonna, this video is probably not going to come out until a while, so that's why I keep saying the dates and all of these, just because I'm going to edit everything when I get back to Maryland and upload them. I don't know how I'm going to upload them yet, so we'll think about that. See, I've just been really itchy. Like, my skin's just really itchy. I hope it's like a sign of healing or something, but I've been able to, just do regular stuff. I'm really glad that I've had energy and I've been able to go out and be walking around and stuff like that. I didn't do a lot of that the first week. I felt like I could, but I just didn't. Because I didn't want to push it. But the second week, I've been like doing regular stuff that I do, going to the store, going to the mall, going to eat or whatever, just regular. I don't really do much. I just do that stuff and then I go work out. So I've just been doing everything except for working out. Anyway, yeah, that's about it. So it's 2 weeks. 2 weeks post-op. I'm really happy with the result. I'm really happy to see what it's going to look like in a couple months when I've been able to start lifting again and start getting my strength going back up and work a little bit more on. I'm probably not going to do any overhead pressing movements or anything like that. Like right now, I'm not lifting my shoulders past like here. So this is about as high as I lift my shoulders right now. So anything beyond that, I'm not going to do. I'm probably not going to do any like chest fly movements for a while either. Just because stretching them out, I don't really move past here. So I'll probably just be doing a lot of benching and maybe some dumbbell work and stuff like that. But when I do get back, I'll probably wait a couple months to do any overhead pressing, and then that'll be, I'll just be spending the rest of the time building up my chest and doing some arm work because I could use a little bicep work, you know, just a little bit, or probably a lot more. All right, so that's me 2 weeks post-op with Dr. Satterwhite. Again, it is January 3rd right now, and so I will see you guys in the next update.